How would you describe the cooperation that you've had with the state? I know, for example, that just on Wednesday, the state opened up vaccinations to anyone 16 and over. That's not the case with Pima County. Why are we hearing different stories depending on the jurisdiction?
Well, at the end of the day, Tony, we can't give vaccine that we don't have. And the state has not put that kind of numbers of vaccines in our hands to be able to put into people's arms. So, one of the big challenges for us is how to best try to reconcile these expectations that are being set by the state with what the expectations and the capabilities, and honestly, the vaccine that supply that we have in order to meet them. But I will tell you that effective on Thursday, rather, the public health advisory has shifted to more closely align with the state's language.
Pima County supervisors want the governor to reconsider denying a permission to FEMA to open up a pod that could vaccinate up to 200,000 residents here in Pima County. What is your take on that? What's happening?
So, Tony, quite honestly, we had a really great visit with the regional administrator for FEMA here last Friday, or actually Thursday before that. And the conclusion of that visit really led us to believe that FEMA is ready and willing to put uh, hundreds of thousands of vaccine doses in Pima County into the state um, for the service of Pima County residents. That they are willing to staff it, they are willing to stand it up, and that they just need sort of the green light from the governor's office in order to do that. For a variety of reasons, that offer was rejected. And this is the board taking action to codify and memorialize that statement and to make sure that they know that the governor knows that we are fully supportive of such an action.
As a medical doctor, would you say that the distribution has been fair and equitable to all of the populations here in the state, or specifically to Pima County, since that's who you represent?
You know, it's at the end of the day, what matters is the number of people sort of covered. Um, you, the state will argue that we are receiving our fair share of vaccine. I will argue back that the state pods have really sucked up a lot of vaccine volume that could have been more efficiently used by our county in particular. It doesn't really matter. I want the U of A state pod to be successful. Um, and I need for all of our own pods here, our collaborative pods, to also be successful. So it is not about who's doing what. It's about how do we put all these efforts together in an effort to achieve the kind of vaccine coverage that we need in order to protect this community.
Dr. Francisco Garcia, thank you very much for joining us.
Thank you, Tony.